हेलो फ्रेंड्स, वेलकम टू माय चैनल एएमएस एजुकेशन। आज हम देखेंगे बाइपोलर डिसऑर्डर। व्हाट इज बाइपोलर डिसऑर्डर? Bipolar disorders are mood disorder characterized by mood swings from profound depression to extreme euphoria with intervening periods of normalcy. So mainly इसमें ये mood disorder है, characterized रहता है इसमें by mood swings from profound depression to extreme euphoria, that is mania. These disorders are linked to early death, primarily due to cardiovascular disease related fatalities being the prevailing reason. And bipolar disorders stand apart from other affective disorders due to recurring manic or hypomanic episodes alternating with depressive episodes. It involves overt manic episodes with symptoms like grandiosity and decreased need for sleep, often accompanied by psychotic features. It is marked by bipolar 2, it is marked by depression alternating with hypomania. So this was about what is bipolar disorder. Next we will see what are the types of bipolar disorder. Bipolar 1, bipolar 2, cyclothymic, bipolar disorder due to general medical condition, substance induced bipolar disorder. So we'll see first what is bipolar first. It is a diagnosis given to an individual who is experiencing or has experienced a full syndrome of many mixed symptoms. The client may also have experienced periods of depression. तो जिसको फुल सिंड्रोम है मेनिया का मिक्स सिम्टम्स का और जिसको पीरियड्स ऑफ डिप्रेशन भी एक्सपीरियंस हो चुका है उसको हम बोलते हैं बाइपोलर 1. बाइपोलर 2 इट इज कैरेक्टराइज्ड बाय रिकरेंट बाउट्स ऑफ मेजर डिप्रेशन जिसमें ज्यादातर मेजर डिप्रेशन के एपिसोड्स होते हैं विथ एपिसोडिक अकरेंस ऑफ हाइपोमेनिया और थोड़ा थोड़ा हाइपोमेनिया होता है. दिस इंडिविजुअल हैज नेवर एक्सपीरियंस अ फुल सिंड्रोम ऑफ मेनिया और मिक्स्ड सिम्टम्स. सो दिस इज बाइपोलर 2. नाउ साइक्लोथाइमिक. The essential feature is chronic mood disturbance of at least 2-year duration, involving numerous periods of depression and hypomania, but not of sufficient severity, and duration to meet the criteria for either bipolar 1 or bipolar 2 disorder. So इसमें chronic mood disturbance रहता है 2 साल at least और जिसमें periods of depression and hypomania रहता है. पर इसको हम कैटेगराइज नहीं कर सकते bipolar 1 या bipolar 2 में क्योंकि इसके symptoms उतने ज़्यादा severe नहीं है. Next है हमारा bipolar disorders due to general medical condition. This disorder is characterized by prominent and persistent disturbance in mood that is judged to be direct result of physiological effect of general medical condition. कुछ जनरल मेडिकल कंडीशन के कारण जो डिस्टर्बेंस होता है मूड में उसको हम बोलते हैं bipolar disorder due to general medical condition. Now substance induced समझ में आ रहा है कि it is associated with disorders that are considered to be direct result of physiological effects of a substance, for use of abuse of a drug or medication or toxin exposure. So these are the types of bipolar disorders. Now हम देखेंगे पैथोफिजियोलॉजी. तो पैथोफिजियोलॉजी of bipolar or many depressive illness has not been determined and no objective biological marker correspond करता है with the disease state. The genetic component of bipolar appears to be complex. The condition is likely to cause by multiple different common disease alleles, each of which contribute to a relatively low degree of risk on its own. Causative factors क्या क्या देख सकते हैं हम लोग biological, biochemical, physiological and medical side effects. So biological में twin studies indicate करता है concordance rate for bipolar disorders among monozygotic twins at 60 to 80% compared to 10 to 20% in dizygotic. Monozygotic में 60 to 80 है, dizygotic में 10 to 20% है. Biochemical में lower level of norepinephrine or dopamine during episode of depression. So depression के में norepinephrine और dopamine का जो लेवल रहता है वो कम रहता है. The opposite to be appears to be individual experiencing mania episode. Physiological light sided lesion है limbic system में. Temporobasal areas, basal ganglia and thalamus have been shown to induce secondary mania. Medication. Certain medication used to treat somatic illness have been known to trigger a manic response. The most common of these are steroids, frequently used to treat chronic illness such as multiple sclerosis, SLE. So, कुछ मेडिसिन के यूज के कारण भी साइड इफेक्ट हो जाता है लाइक और जो मोस्ट कॉमन है स्टेरॉइड्स जो कि ट्रीट करने के लिए लिया जाता है मल्टीपल स्क्लेरोसिस, सिस्टमिक लूपस एरिथ्रोमाइटिस, SLE. So these are the positive factors. Now we'll see what are the signs and symptoms. तो साइन एंड सिम्टम्स में सबसे पहला है heightened, grandiose और agitated mood, exaggerated self-esteem, sleeplessness, pressured speech, flight of ideas रहेगा, reduced ability to filter out extraneous stimuli, easily distractible रहेगा, easily attention span जो रहता है limited रहता है, concentration कम रहता है और easily distract हो जाता है. Even the slightest stimulus in the environment के कारण वो distract हो जाता है. Increased number of activities with increased energy. तो motor activity constant रहता है, individual literally moving रहता है, पूरे टाइम वो move कर रहा है. Motor activity increased रहता है इनका. Multiple grandiose high risk activities using poor judgment with severe consequences. So these are the signs and symptoms of bipolar disorder. अब हम देखते हैं assessment and diagnostic factors क्या करेगा. CBC, ESR. CBC हम करते हैं ताकि हम एनीमिया को रूल आउट कर सके एज अ कॉज ऑफ डिप्रेशन, bipolar disorder. ESR to determine to look for underlying disease process such as lupus or an infection. Elevated ESR indicate करता है underlying disease process को. Fasting is indicate to rule out diabetes. Electrolytes are measured to help diagnose electrolyte problems such as especially with sodium that are related to sodium. Protein. Low serum protein levels found in patients who are depressed may be as a result of not eating. Thyroid hormones are performed to rule out hyperthyroidism, which is linked with mania, and hypo with depression. Creatinine and burn. Kidney failure can present as depression. Treatment with lithium can affect urinary clearances. And serum creatinine and blood urea nitrogen level can increase. Substance and alcohol screening. Alcohol abuse and abuse of wide variety of drugs can present as either mania or depression. MRI. The total value of performing an MRI in patient bipolar remains unclear. However, a couple of reasons do exist for performing imaging study. ECG. Many of antidepressants, especially tricyclic agent and some of the antipsychotic, can affect heart and cause conduction problems. So this was about assessment and diagnostic factors. Medical management हम psychotherapy, ECT, diet, activity. So psychotherapy help करता है patient with bipolar disorder but does not cure the disorder itself. ECT is usually number of instances in patients with bipolar disorder, such as when rapid definitive medical treatment is needed, when the risk of ECT are less than that of other treatment, when bipolar is refractory to adequate trial with other treatment strategies, and when the patient prefers this treatment modality. People should be advised not to make significant changes in their salt intake because increased salt intake may lead to reduced serum lithium levels and reduce efficacy, and reduced intake may lead to increased levels and toxicity. Activity. Patients in depressed states are encouraged to exercise. These individuals should try to develop a regular daily schedule of major activities, especially times of going to bed and waking up. So this was about medical management. Now we'll see what are the pharmacological management. Anxiolytics, benzodiazepines. By binding to specific receptors, benzodiazepines appears to potentiate the effects of GABA and facilitate inhibitory GABA neurotransmission. Mood stabilizer lithium, जो कि एक common drug है used for prophylaxis and treatment of manic episode. Anticonvulsants have been effective in preventing mood swings associated with bipolar disorder, especially in those patients known as rapid cyclers. Antipsychotics second generation. These are increasingly being used for the treatment of both acute mania and mood stabilization in patients with bipolar 1. Antipsychotics first generation, also known as typical antipsychotics, are effective in treating both psychotic and non-psychotic mania and mixed episodes, as well as hypomania. Antipsychotic phenothiazine are classified as first generation, are effective in treating both psychotic and non-psychotic mania and mixed episode, as well as hypomania. Anti-Parkinson's agent, dopamine agonist, a non-ergot agent that bind to D2 and D3 dopamine receptor in the striatum, and substantia nigra. So this was the pharmacological management. Now we will see nursing management, nursing assessment. So assessment of patient with bipolar disorders includes history. Taking a history with client in manic phase often prove difficult. Obtain data in several short sessions as well as talking to family members may be necessary. General appearance and motor behavior. So client with mania experience psychomotor agitation and seems to be perceptual. Perpetual motion sitting still is difficult. This continual movement has many ramifications. Client can be exhausted and injure themselves. Mood and affect. Mania is reflected in periods of euphoria, exuberant activity, grandiosity, and a false sense of well-being. Thought process content कैसा रहेगा? Cognitive ability of thinking is confused and jumbled, with thought racing one after another, which is often referred to as flight of ideas. Clients cannot connect concepts and they jump from one subject to another. So based on this, diagnosis can be risk for the other directed violence related to manic excitement, suspicion of others, paranoid ideation, risk for injury related to extreme hyperactive destructive behavior, imbalanced nutrition less than body requirement related to refusal or inability to sit still long enough to eat meals, disturbed thought process related to psychotic process, disturbed sensory perception related to sleep deprivation, psychotic process. Therapeutic nursing management environment, psychological treatment, individual psychotherapy, group therapy, family therapy, somatic में ECT, psychopharmacology. नर्सिंग इंटरवेंशन क्या करेंगे? असेस करना है क्लाइंट का सुसाइडल फीलिंग एंड इंटेंशन एंड एस्केलेटिंग द behavior regularly. Set consistent limits on inappropriate behavior to help the client de-escalate. Establish करना एक calm environment for the client. Reinforce and focus on reality. Provide outlets for physical activity but prevent client from escalating. Client may be very likable during high periods. Staff members need to avoid participating in this behavior. At other times, client may be very irritable and staff members should approach client quietly and with limits if necessary. If the client cannot control self and other methods are not successful, staff need to provide client protection if threat of a self-harm or injury to other exist. Monitor client nutrition, fluid intake, and sleep. Discuss with the client and family the possible environment or situational causes, contributing factors, and trigger for a mood disorder with recurrent episodes of depression and mania. Evaluation goals are met are evidenced by client is able to differentiate between reality and unrealistic events or situation. Client is able to recognize thoughts that are not based in reality and intervene to stop their progression. Client has gained or maintained weight during hospitalization. There is no evidence of violent behavior to self and others. Client is no longer exhibiting signs of physical agitation. So this was about my topic, bipolar disorder. I hope you like the topic. Then please give your feedback in comment section and please like, share and subscribe. Thank you.